Hey, what's going on, sports rehab experts? Look, we get it. Plantar fasciitis sucks, especially in the morning. I mean, wake up in the morning, first step you put on the ground, and it's super painful. You kind of limp around for a little bit in the morning. It stinks. How do we fix it? And fix it for good to make sure it doesn't come back in a sustainable solution that is easy for you to do at home without spending thousands of dollars on the million different treatment options that you have that are out there that you're not sure of if they will work or not. You need to have confidence in the solution. So today we're going to try to instill some confidence, some direction into what you need to do in order to overcome plantar fasciitis. We're going to go over my two favorite exercises as well as a progression to each of those exercises. So you're actually going to get 4 exercises that you can take away today after this video to start overcoming the plantar fasciitis problem and that painful first step that you get in the morning. Now, before we get into all that, be sure to like and subscribe to the channel, share it with anybody you think might need this video to help overcome plantar fasciitis and that painful first step in the morning. But we need to deepen our understanding about what plantar fasciitis is and what the foot is supposed to accomplish and what our foot does when we walk and when we step and when we take that first step in the morning. Our understanding of what the foot is supposed to do gives us a better indication of what we need to do to help solve that and what we need to help prepare our foot for, so that we become more resilient and we experience less pain with that task of walking, especially after you've laid down for a prolonged period of time sleeping, and now all of a sudden you take that first step, your foot hits the ground, and now it actually stretches out. And again, usually that's fairly sensitive for someone who's dealing with plantar fasciitis. The pain is right at the base of their heel, right in the inside of their foot. So what you might see is someone who walks on the outside of their feet all the time. They never actually kind of roll over top of their foot and push off their big toe because they're trying to avoid that rolling action, and they need to stay on the outside of their foot because that's all that's comfortable, because putting pressure on the inside of the foot will stretch that plantar fasciitis out and will actually cause pain in some instances just due to the tugging effect of the tissue that it experiences. Now, what we need to understand is that the foot flattening out is actually a normal phenomenon that happens within the body, that happens within the foot. It's what allows us to attenuate forces. So we need to stop calling feet flat or feet arched, because neither one is good nor bad. Both are useful given the correct circumstance. So a flatter foot, or a foot that is flattening out, is a better force absorption shape. A foot that is higher arched is a little bit more rigid and applies more force into the ground. So again, you can see how a rigid force propulsion type foot and a force absorption type foot, two ends of the spectrum, can be useful for a variety of different things that you might do throughout the day. Ultimately, it's a gradient. We should be able to move back and forth between one another and utilize that force absorption, but then also utilize a more rigid foot for propulsion. So that rolling over top of the foot is an action we need to get the body gradually exposed to if we're going to overcome this painful problem of taking a step in the morning. The problem is, it's super sensitive, right? So we just can't force our way into this. We can't just try to run through a brick wall and solve this problem. We have to ease our way into it, gradually expose ourselves into that position over and over again, so that the body adapts and builds itself stronger. So the first 2 exercises, actually the first exercise and then the progression to that exercise, is what we're going to be going over first and foremost, how to gradually expose yourself to this position. Now, if you're dealing with that morning pain and you're having trouble with that first step in the morning, what you might want to do is start your day out with this type of exercise to ease that first step, to ease yourself into that first step and make sure that it isn't quite as painful. So it's a very nice exercise to get the body moving again, and then once the body's moving again, it feels more comfortable moving again, then our emphasis turns into loading that tissue so that the tissue builds up more strength, more resiliency, a better able to withstand tensile forces, so that you don't have to deal with this issue ever again. So it's a 2-step solution. One is a gradual accommodation to accepting that spreading or that force attenuation that the foot should be able to do so that we can walk normally. And then furthermore, once we've established that capability, then we want to try to strengthen through a full range of motion that stresses the plantar fasciitis in a progressive manner that makes it more resilient.
All right, so this is the very first exercise, and all that you're going to need is a folded up towel roll, and you're going to place it underneath the heel. This will allow the ankle and the heel rocker to occur a little bit more naturally, a little bit more fluidly, and all that we're thinking about doing is weight shifting our hips and shoulders over top of the foot. And as we do that, we're going to notice that the foot will flatten out and the foot will almost like spin onto the inside aspect of the heel as you start to load the inside aspect of the foot. Now, you always keep 3 points of contact with your heel, big toe, and little toe, but we want to see that foot flatten and spread out just like a trampoline. If you're jumping on a trampoline, the trampoline will spread at the bottom before it recoils back up. So as you shift forward and backwards, you're going to notice the arch flattening and the arch raising back up. Now, when you rock backwards, that's when the arch will lift up, the toe will lift up towards the ceiling, and the arch will resume itself again. As you can see me here, I'm standing. This is what it looks like from a full body shot. Is we're rocking forward, we're weight shifting forward, and we're rocking back. As we shift forward, the foot flattens. As we shift back, we pull the toe up and the arch rises. Now, this is the progression to it where we add a second towel and we put the towel underneath the big toe. Towel underneath the big toe just creates a little bit more of a hammock effect where we're creating a bridge between the heel and the forefoot to allow the plantar fascia in the midfoot to spread a little bit further. So you're going to notice an increased stretch with this one. So again, just make sure it's pain-free as you do it and the foot feels like it loosens up as you go along. But this would be the progression to just using the heel elevated. Now, when we progress eventually to strengthening, what you'll notice here is we're going to use a towel. So a towel we're going to place over top the big toe, but the knuckle of the big toe is going to be still flat on the ground. And we're going to perform a heel raise. So this is a single leg heel raise. You might not be able to start here depending on your current physical capabilities as well as your current pain levels. So you might have to start with 2 feet on the ground. That's perfectly fine. But then we're going to try to keep progressing you, whether that's progressing to a single leg version or, as we show in the next video, is the heels elevated. So this could be, again, done 2 feet first before you progress to single leg. But in either case, we want to progress to a single leg version as you're comfortable. And the further range of motion that you progress through, the further stretch you're going to feel, and you're going to strengthen through a larger range of motion. So 2 foot to 1 foot, flat ground to heel elevated. But the whole time we're keeping that towel over top the toes and the knuckle down the big toe is down on the ground. That creates a little bit stretch through that first ray. And what you'll notice with that is an increased stretch going through the plantar fascia. So that's the purpose of the towel. The towel needs to be there so that you can feel that extra stretch. If you roll the towel up a little bit, you're going to get an even more larger stretch sensation. So again, just perform it to your comfort level and try to progress in a manner that is comfortable for you, whether that's 2 foot to 1 foot, flat ground, heels elevated, or rolling the towel up a little bit more to get a larger stretch and strengthen through a larger range of motion with the plantar fasciitis.
All right, so there you go. There's a 1-2-step solution to get rid of plantar fasciitis pain, especially that pain with your first step in the morning. Now, obviously, these are just 2 exercises. There's a full gamut of exercises and activities that might be useful for you based upon your given scenario and your body structure. So if you are a rehab clinician looking to learn more about all the different methods that we use for plantar fasciitis, be sure to check us out at sportsrehabexpert.com and jump on one of our courses, the Sports Rehab Expert Fast Track course or the Sports Rehab Expert certification. If you're someone just who's dealing with plantar fasciitis and looking to get some more help, email me at greg@sportsrehabexpert.com and more than happy to kind of talk you through some different options that we have to help solve your issue. Thanks again for tuning in. We'll be back at it next week and talk with you soon.